It's tips time. Welcome to Training Intervention Program for Behavior Change. Tips for Behavior Change. I am your psychologist and behavior specialist Geraldine Garwood. Please remember to like, subscribe, and click the notification bell. It's Mental Health Month. October is celebrated as Mental Health Month, and I will be doing a series on childhood mental health. But before that, I want to do a general overview of what is involved in mental health so that we can be more sensitive and be more aware of those who are diagnosed with a mental health condition. So, mental health is not limited to only children but adults also. And we will look at today some of the types of mental health that persons are diagnosed with. But first, let us look at a definition of mental health. What is mental health? And so, when we talk about mental health, we think of grief, we think of anxiety, we think of phobia, we think of stress, post traumatic stress, we think of shame, and we think of depression. Yes, depression, panic attack, phobia. Those are some of the things that we think of when we think about mental health. So, what exactly is mental health? Mental health involves emotional, psychological, and social well being. It involves all of that. It influences how we think, how we feel, how we act. It determines how we deal with our stressors, how we interact with others, and makes decisions. Mental health is important at every developmental stage of life. So we need to understand that mental health is not limited to a particular developmental stage, but can actually impact development throughout the lifespan. And so mental health is to be talked about. Oftentimes, it is a taboo and most persons are uncomfortable talking about issue of mental health. But we should have discussion as it relates to mental health so that persons can be more aware and sensitive. And I will always be emphasizing that sensitive towards those who have a mental health condition. So, mental health, there is ignorance, a lot of ignorance out there, superstition and stigma, fear which surrounds issue of mental health. And mental health can affect just about anybody. And it is not limited to a particular race, ethnic background, or ethnic group, but it can affect persons from different strata of society. So, persons from different age group, and most importantly, we are all vulnerable to a mental health condition. And that is why it is important that we learn to take care of our mental functioning. And for those who are already diagnosed with a mental health condition, it is important for us to understand how we cope and how we work and support such individuals. And so, categories of mental health include substance problems, or what I would call drug problems. So, persons who have addictive problems or who are dependent on substances such as heroin, cocaine, marijuana, alcohol. They will have drug related illnesses like psychosis, delirium, and dementia. So, persons who are substance dependent can be diagnosed with a mental health condition. And then we have those persons with personality disorders. And what is a personality disorder? It is a personality and behavior that is damaging to the person or the individual and also to the society. And it is not tolerated by a dominant culture. And so, what are some of these personality disorders? We're talking about schizophrenia, Alzheimer, we're talking about bipolar, borderline, narcissistic, histrionic behavioral patterns. We're talking about persons who may have Alzheimer's as well. And so these are some of the personality disorders that we may have to deal with, that some family members may be diagnosed with. And then we want to talk about another group of mental illness, learning disorders. And so I indicated that I will be focusing on a couple of videos that talk about childhood mental health. But learning disorders are problems that surround intelligence and the ability to learn, the basis of teaching and learning. That's what's involved in learning disorders. So we may have a child having dyslexia, intellectual disabilities, autism, Asperger, um, other disorders, childhood disintegrated disorder, although now combined as one into autism spectrum disorder, attention deficit hyperactivity disorder. These are some of the categories of mental illness. But as stated earlier, there is a stigma attached to mental illness. So most parents are uncomfortable to share a diagnosis of probably autism spectrum disorder and attention deficit hyperactivity disorder. But there should be no shame surrounding a mental illness because there are always interventions and coping strategies to help persons to be functional and deal with their mental illnesses. And so, how do we maintain a positive mental health? Some of the things we need to do: get professional help. So, if you have a child diagnosed with a mental health condition, if you have a family member diagnosed with a mental health condition, get professional help. Next, build positive relationship. It is good to have positive friends around, positive peers around. Surround yourself with positive persons who can give you the support that you need. Develop coping skills. And for every mental health condition, there are a variety of coping skills that can be introduced to a person so that they can cope with the challenges that come with such a mental diagnosis. Most importantly, love yourself. Love yourself, affirm yourself, encourage yourself, appreciate yourself, and accept yourself for who you are. Exercise, very critical that we exercise and also maintain a nutritious diet. So we eat right and we exercise. Lastly, have fun. It is important that we learn to have fun, enjoy ourselves, enjoy small moments with family and friends. Play a game, watch a movie, read a book, relax, rest, have fun, enjoy life. And so these are just a few tips to help us to cope and to deal with and to appreciate those who may have a mental health condition. Let us be sensitive towards persons with mental health and let us be aware of what is involved with mental health. Please remember to like, subscribe, and click the notification bell and stay tuned for follow-up videos on childhood mental health challenges.